Hi everyone, welcome back to my channel Dr. Shahan's class, and here in this video I will tell you about carcinoid syndrome. Carcinoid syndrome is very important topic, a hot topic for different medical examination. Either it may be NEETPG or FMGE or other examination like PLAB or USMLE. So you must know about carcinoid syndrome. Carcinoid syndrome is caused by serotonin. Remember this, serotonin. What is causing carcinoid syndrome? Serotonin, serotonin, serotonin. So remember, carcinoid syndrome is caused by serotonin and other neuropeptide. So what is causing? Serotonin and neuropeptide. What happens? Basically, there is neuroendocrine tumors. And these tumors are located in your gut and may spread to the lungs, and it produces symptoms like flushing, diarrhea, and right-sided valvular defect. So what is carcinoid syndrome? What is the definition of carcinoid syndrome? Carcinoid syndrome is a paraneoplastic syndrome. It is a paraneoplastic syndrome and it comprises of the carcinoid tumors. So it is because of tumors. What is the name of the tumor? Carcinoid syndrome. So carcinoid tumor. And what it produces? Symptoms. The symptoms, remember the symptoms, very important. They will give you a case of flushing and diarrhea. Flushing and diarrhea. Flushing and diarrhea. Flushing and diarrhea. If these two things are mentioned, then 100% it is carcinoid syndrome. Flushing and diarrhea. And why this is occurring? Because the level of serotonin, I already told you, because of the level of serotonin has been increased in your body, because of the serotonin. And what is from where this serotonin is coming from? Serotonin is coming from the neuroendocrine tumors. Where are these neuroendocrine tumors situated? These neuroendocrine tumors are situated in your gut, basically in the gut. You can see the picture. This is the picture of the gut, where you can see the primary site of the carcinoid tumor of gut. So this is the primary site. Primary site is in the gut, you can see. And where is the secondary? Here you can see the picture. The secondaries are invisible on the mesentery. So the secondaries are in the mesentery. Sometimes the secondary tumor can also spread to the lungs. Remember, lungs, that is known as lungs NET. NET means neuroendocrine tumors. Lungs neuroendocrine tumors, which are secondary. Primary generally occurs in the gut. You can see primary generally happens in the gut. Where does it happen? It happens in the gut. Remember the primary. So what are the features we can see? What are the symptoms we see? Number one is the flushing. I already told you, flushing is there in the carcinoid tumor. Why flushing is there? Always remember, flushing is there because of this increase in the serotonin level. Where does this serotonin is coming from? From the neuroendocrine tumors, which is primarily situated in the gut. From there, in the circulation, the serotonin levels has been increased, and because of that, you can get flushing. You can get redness, flushing. Next is diarrhea. You may also get diarrhea. Why this diarrhea is happening? Why loose motion? Why there are a lot of stool passing? Because of the serotonin. Here also serotonin, gastrin, histamine, all these hormones, not only serotonin increase, other hormones like histamines and gastrin are also increase. So basically these things are causing the diarrhea, causing a lot of loose stool. Next is abdominal pain. You will also get cramping in your abdomen. Abdominal cramping, abdominal pain is there. Why this is happening? This may be due to hepatomegaly. If you palpate the liver of this patient, you can find out that this patient is having hepatomegaly. And also you can find the small bowel obstruction. You can find SBO. SBO means small bowel obstruction. Why small bowel obstruction happens? Basically all these reasons are because of the tumors. Because of the tumors, the small bowel can get obstructed and you can get small bowel obstruction. Or you can also get lack of oxygen in the small bowel. Another thing you can get is bronchoconstriction. Why? This may be due to histamine or serotonin. Other thing which you may get is the carcinoid heart disease. I told you carcinoid heart disease, that means this carcinoid syndrome actually affects the right side of the heart. Which side? Right side, right side, right side. So many times it has been asked in the question. Right sided heart has been affected in this carcinoid syndrome. Remember, right sided heart. And which valve? Which valve? Which valve? It is tricuspid valve, tricuspid valve, tricuspid valve. And because of this tricuspid valve, you get tricuspid regurgitation. Sometimes you get tricuspid regurgitation. All these are questions. Tricuspid valve, which valve affected? Tricuspid valve, tricuspid regurgitation, right sided. All these are questions. Now see this picture. You can see this picture. This picture actually showing the carcinoid tumor, carcinoid syndrome. Carcinoid syndrome basically refers to the NET. I told you NET. NET means neuroendocrine tumors. These tumors are situated primarily in the gut. Primarily in the gut. It may also metastasize to other region, but generally primary is found in the gut, and it may spread to the mesentery and all this. And I told you secondary may go to the lungs. Always remember this. And what are the symptoms? Mainly look at the below picture. The symptoms are very important. Flushing. You can see the face. When the patient comes, you can see the face. The face is flushed. The face is flushing. So flushing. Why this happening? Because of the serotonin increase. Serotonin increase. And the patient will also complain of the abdominal cramping, abdominal pain, and diarrhea, loose stool, edema can also be seen. Now what is the mnemonic of this carcinoid syndrome? Very important. Mnemonic of carcinoid syndrome, remember from the name carcinoid, carc, C-A-R-C, carc, carcinoid. So carcinoid, C-A-R-C, that is the mnemonic. C means cutaneous flushing. C means cutaneous flushing, cutaneous flushing. C. A means asthmatic wheezing. There is a wheezing. The person is wheezing. Second is asthmatic wheezing. R, what is the R symbolize? R means right-sided heart. I told you right-sided valvular heart disease. Right-sided valve affected. Which valve? Tricuspid valve. I told you. Which valve? Right-sided. Which valve? Tricuspid valve. And C means the cramping. What happens in the cramping? I told you abdominal pain, small bowel obstruction, all these occurs. So abdominal pain, cramping, and sometimes hepatomegaly is also seen. So abdominal pain, cramping, diarrhea. So that is C, cramping, the last C. So remember this C-A-R-C, that is the mnemonic. C for cutaneous flushing, A for asthmatic wheezing, the person is wheezing, asthmatic wheezing. R means the right-sided valvular heart disease, mainly the tricuspid valve. And remember the last C, that is cramping, abdominal cramp, abdominal pain is there, diarrhea is there. So this is me. So this is the end of this video. If you like this video, make a thumbs up and please write down in the comment section below. Thank you so much for loving this channel. Please subscribe this channel if you are new to my channel, and write down in the comment section below what are the topics you want me to make more videos on. Thank you so much for watching this channel, and this is the channel on different diseases. This channel will 100% increase your knowledge on different diseases. So please subscribe. Have a nice day. Bye bye. Thank you.